ideal world, there would be a midwife for every woman that wanted one, and there would be easy access. There would be an integrated system that respects women who choose midwives and respects the midwives who provide that care. And we would all work together seamlessly, honoring those choices, honoring the expertise that midwives bring to the healthcare system. Ideally, this idea of truly woman-centered care would be embraced as the gold standard of care in this country. That would be ideal.
I don't just envision it. I think it's going to happen. I mean, I think, the world needs more midwives. I mean, I have my bumper sticker on my car. My sister now has it in San Francisco, and it says, every woman deserves a midwife.
In an ideal world, we would have probably more than 120,000 midwives working. I mean, every small town would have at least one midwife, better two. We would have a lot more family doctors involved, as they used to be, working with those midwives. You're not going to get an obstetrician in every little town, and nor would we need to.
I would love to see that midwifery is an integral part of the healthcare system, that it is open, there is easy access to any midwife for any woman of any caliber, societal level, economic status, race, ethnicity, that midwifery is the gold standard, and I'm convinced that immediately we would see a massive change in our outcomes, both mothers and babies.
I think that midwives in the United States are the answer to our national healthcare crisis. We're spending so much money on prenatal care while simultaneously serving the smallest percentage of pregnant women anywhere, and I think that's a travesty. If you look at all the other high-income nations that have better outcomes than we do, they have two things in common. They've got universal health care, and they've got midwives as the primary care providers, and those two things are linked. Midwifery care is much less expensive, it has excellent outcomes, and if we're really going to serve everyone, we have to start thinking about a midwifery-dominated system in the U.S.
We need midwives to work in every setting. We have to have home birth for those women that choose that and who are well prepared. We also need to have birth center birth, and we need to have midwives in hospitals too.
So in the ideal world into the future, it would be a place where women feel confident about birth, where they feel reassured by their healthcare providers, starting within a midwifery service, going into the obstetric service as necessary, having the pediatric service there as needed. But it would be a world where birth is welcomed within the community and women are supported by their communities as mothers of the future.
The lasting message that I would like to send to women of color, to Latina women, to all women, is that when and where and how you enter is very important, first of all. But most importantly, your birth and how it happens will affect you for the rest of your life. And having a baby gives you a very unique opportunity to tap into something bigger than yourself. And if you are able to do that, I always tell my ladies there are three things that they can do. They can deliver a baby, they can be delivered of, or they can give birth. And there's something magical and life-changing about giving birth.